received this phone call. Hi, I'm from Medicare. I want to explain the new Medicare summary notice and would like to come to your house to talk with you about it. Have you fallen for this scam? Medicare would never call and ask to come to your house, and we're going to tell you why with today's guest, Sandy Risdon of Center for Healthcare Rights. Sandy, let's talk. Welcome.
Thank you.
So Sandy, I know this is a basic question, but what is Medicare?
It's a good question. It's a basic question and a good question. Medicare is insurance that people get after paying into Social Security on a job. It could be them, it could be their spouse or former spouse, but everyone has to pay into Social Security in order to get an insurance benefit at retirement or if they're younger on disability from Medicare. So Medicare is health insurance for hospital, for doctor, for drugs primarily. And of course there's all kinds of details we can go into, but it's insurance that you get when you pay into a job through Social Security.
And for a certain number of years or for?
Well, the minimum requirement is 10 years of payment, so it's 10 years or 40 quarters of Social Security units and so on in order to become qualified for Medicare and to get Part A hospital insurance without a premium payment.
Okay, so Social Security and Medicare are linked.
Definitely. And folks actually enroll in the Medicare program through Social Security.
Okay.
Medicare program would have no role in enrolling people. It is Social Security.
Okay, so
they
basically
determine eligibility and enrollment.
Okay, great. So you are the program manager for HICAP. Now that's another acronym, and you know people in acronyms are kind of confusing. Can you tell us what does HICAP stand for?
You bet. HICAP, H-I-C-A-P, Health Insurance Counseling and Advocacy Program. HICAP is a program that was established by the California legislature back in 1984, and it was designed to provide funding to each county to serve Medicare beneficiaries and their families in understanding Medicare options and receiving unbiased information and assistance with Medicare problems. So HICAP has really been around since 1984. It's coming into its 30th year next year. Now we're in our 29th year of service. And there are 24 HICAP programs statewide here in California. California's HICAP program was third or fourth in the country in terms of being established. And after, in the 80s and 90s, the rest of the states also got HICAP style programs. Federally, we're called SHIP, another acronym, State Health Insurance Assistance Program. So if you just take the A out, it is SHIP, which is, HICAP style program in every state, every county, and, available to all Medicare beneficiaries throughout the U.S.
So your program, so basically you're not, what, 10,000 people are enrolling every month on Medicare?
Nationwide, 10,000 people a month are becoming eligible for Medicare.
Okay.
This is due to the baby boomers coming of age, baby boomers born between 1946 and 1964. Here in LA County, we have lots of folks. Remember, LA County is Medicare's largest county. So in the United States, we have 1.25 million Medicare beneficiaries here in LA County.
That's a lot.
Yes, that is just huge. And when you think about the geographic issues, all the way, it's 50 miles in any direction and all the way up to Edwards Air Force Base. It's a very significant geographical territory to cover. And of course, we have a great deal of linguistic and cultural diversity. So it's a very important population to serve, and Medicare's largest nationwide.
And what a challenge for HICAP and Center for Healthcare Rights. I mean, you can't do that. You have a lot of volunteers, and you train a lot. I mean, what is your core now? How many?
Well, we have professional staff at the Center for Healthcare Rights. We're a nonprofit organization. We have professional staff, including paralegals, health insurance specialists, attorneys. But a lot of our work in the community is done through volunteer counselors. And we're right around 30 at this point. We're always looking for more volunteer counselors. They go through a very significant training program prescribed by the state. There's a state-mandated internship before they're registered by California Department of Aging. So it's a significant commitment. We have very, very dedicated counselors. Average length of service about 7 years.
Oh, that's so gratifying.
So yes, they seem to like it.
So I'm sure you get this call all the time. Okay, I qualify for Medicare. What are you going to do for me? Help.
Yeah, what's next? I'm inundated by a stack of mail that arrives every day. I'm afraid to open this mail. It's it's stacking up and so on. A lot of these are actual advertisements from companies that are contracted to Medicare, Part D drug plans or Medicare Advantage plans, HMOs and the PPO. So we help people wade through the material. We help people understand what Medicare covers. Number one, what Part A covers, hospital. Part B covers doctor, and Part D drug, and talk then about their options. Now, options, of course, would include having Medicare all by itself, original Medicare, where someone would take their Medicare and go to any doctor in the United States that has a Medicare contract, and that's most doctors, certainly in LA County and in California. Another option would be a Medicare Advantage plan, which is Medicare HMOs and the PPO. LA County has the highest market penetration of Medicare Advantage plans in the country, which are serving Medicare's largest population of any county, the 1.25 million. So there's lots of Medicare Advantage plans to choose from. We also have the Medicare Supplement Option Medigap insurance, which links with original Medicare to provide fee-for-service entry for folks to use any doctor or facility that accepts Medicare. A lot of folks want counseling on, they're going to keep Medicare and just have drug coverage. What are their options? Do all the drug plans cover the same drugs? What is the donut hole? Everyone has a unique experience of Medicare, at least at first, but overwhelmingly, I think people say, I have too much information. Can you help me sort through it and identify real and true options that I can consider? They're after unbiased information and advocacy on our part, and that's what we supply, of course.
So some of the stuff you get in the mail is really advertising.
A lot of it is advertising.
And people can be misled by some of this advertising.
Well, a lot of folks, of course, think that you have to enroll in a Medicare HMO. That's certainly an option, and it's one that a lot of people make full use of. But I guess the issues in terms of deciding what to do with Medicare sometimes have to do with your current provider, your current healthcare provider or doctor. So it may be that the doctor is contracted to this Medicare Advantage plan and not to that one. So when people are deciding about which plan to enroll in, if they want one, that comes into play. Medicare Advantage plans coverage of drugs may be different plan to plan. Certain drugs covered, others not. So these are two factors that we look at very carefully when we help people sort out what the options are. We use the Medicare website quite a bit, medicare.gov. It's a wonderful website. It's had a lot of real good upgrades, and our staff use it all the time to help narrow down options for folks.
And the lay people can go there too. So medicare.gov.
Sure. That's right, medicare.gov, and there's a health plan finder on it, which has all of the Medicare Advantage plans loaded in. Just put your county in it. It has all the Medicare drug plans in it, so you can actually enter your medications, enter your pharmacy, push a button, and find out in rank order, the least costly first, what the options are.
Well, that's helpful. Very helpful. So what are some of the major misconceptions about Medicare? What are the most confusing things that you hear or questions that you get about Medicare?
Well, I guess the most, I'm always surprised, but folks say, gee, I didn't understand that there were any costs associated with Medicare. I thought it was all free. So I'm not understanding why there's an annual deductible on original Medicare, hospital deductible, a 20% coinsurance. They're just unaware of this. And, this applies to original Medicare. It doesn't apply to most HMOs. We try and help people understand that. It doesn't apply to folks who have Medigap insurance, supplemental insurance, because that coverage is designed to pay those costs. But I think that's the first impression a lot of us hear when we hear from someone new to Medicare is, what do you mean they're costs associated? I thought this was all free. So we do help folks understand the basics on it. And I guess a lot of folks think that, managed care is a requirement. It isn't. It is certainly a very good option for people, especially who are trying to reduce their costs on Medicare. Because for the most part, Medicare Advantage plans don't charge Medicare's 20% coinsurance. They charge small copays. And that's, so you can save money that way. So I think those are two things that we hear right off the bat from folks new to Medicare who call
And the
us.
donut hole, I'm sure you hear.
A lot of confusion about the donut
What
hole.
is that?
Most people never hit it.
Okay.
The donut hole is an area of non-coverage in the middle of the Part D benefit.
Okay.
You have to spend around $950 out of pocket to reach it in a year.
Okay.
Most people will not necessarily spend that. And if you do hit it, the good news is for the past couple of years, the Medicare program has been reducing the size of the donut hole, the cost. And in 2020, the donut hole actually goes away. The donut hole will not be with us for good in 2020.
So that would mean what exactly?
Flat 25% copayment.
Which is better?
We have 25% copayment now, and then the donut hole.
Okay.
And in 2020, there would just be a flat 25%.
And so for beneficiaries, that's a good thing.
It is definitely a good thing. Thanks to some legislation, the donut hole is actually shrinking every year. This year, a Medicare beneficiary pays, I think, 52% in the donut hole. In 2009, they were paying 100% of costs. So it's actually reduced significantly, and it has been going down each year.
And so what are your thoughts basically about Medicare? Is it going to be around for a while, or what?
Oh, yes.
Okay.
I think it's going to be around for a while. I think the American people, it's the most popular program of the federal government. It's having a 50th birthday in 2015. We have 50 years of Medicare. It's done wonders for folks. It's improved health, drug coverage now available. I think it's going to be around for a long, long time to come. I think Congress is going to figure out how to make it on a better financial footing over time.
Well, good. Well, good on them, finally, right?
Yes.
So we're going to go quick to a break. Okay.
Mm-hmm.
So we know now that there's help out there for when we reach that golden age and become beneficiaries of Medicare. It's complicated, and more so since the passing of the Affordable Care Act. Sandy's going to explain how the act affects our benefits when we come back on Let's Talk.
Hey, slow down!
Right next to the library on 7th Street is the Santa Monica History Museum, where history comes to life for the entire family. Enjoy the exhibits, main gallery, the photo archive, research gallery, and much more. Come visit the Santa Monica History Museum, keeping history alive.
Welcome back. Sandy Risdon from Center for Healthcare Rights. We're talking about beneficiaries of Medicare and the Affordable Care Act.
Mm-hmm.
So we were talking about the donut hole. So I know the Affordable Care Act affects the donut hole. So why don't we start with that and then some other ways that the Affordable Care Act is going to affect us?
Sure. The Affordable Care Act was signed in 2010. The major provisions of it go into effect in 2014. But it's had a big effect on Medicare already. I mentioned a little bit earlier about the Medicare Part D donut hole. The Affordable Care Act, as I mentioned, actually eliminates the donut hole by 2020. It's going down so much per year from 2010 until then. Right off the bat in 2010, right after signature, the Affordable Care Act gave immediately a $250 rebate check to anyone in the U.S. on Medicare who was in the donut hole. And that started, I believe, in June of 2010. Through December of 2010, you had some financial assistance from the federal government in the donut hole if you were in that at that time. There's a number of shoring up provisions that the Affordable Care Act has done for Medicare. One of the important provisions that the Affordable Care Act had was on Medicare Advantage plans. And on Medicare Advantage plans, thanks to the Act, were required to meet loss ratio limits of 85%, which is the insurance industry standard. This means that 85% of funding from the federal government that's received from, for Medicare Advantage plans has to be used on patient care and so on, as opposed to other administrative costs. And that, again, is an industry standard. And I think people feel much more confident about that. There's no question. I guess one of the most impressive parts of the Affordable Care Act and its effect on Medicare has been how it has reduced or eliminated most costs on prevention care services. And prevention care services was something that Medicare really didn't have as big a stake in over time as it might have. It tended to fix things as people went along as opposed to really getting in there and doing a lot of prevention. Of course, everyone's familiar with flu shots, and folks have been getting that under Medicare for years. But under the Affordable Care Act, a couple of things were initiated. One would be the initial preventive physical exam, which Medicare never had a covered physical exam before 2005, called Welcome to Medicare Physical Exam. And it's available to anyone who starts Medicare and for 12 months after Medicare begins. It's a comprehensive assessment of state of health at the time of the exam. They do some risk assessment, falls assessment and so on, and a series of tests as appropriate as the doctor and the Medicare beneficiary discuss it. There is no deductible for it. There's no copayment. There's no charge of any kind. It's completely cost-free.
It's like a baseline reading kind of.
It is a baseline reading. That's exactly right, because after a baseline reading is established, any Medicare beneficiary, whether they've been in the program 30 years, can get an annual wellness exam. Annual wellness exam, which gets a lot of baseline readings, more health risk assessments, and so on. Real comprehensive history, a very comprehensive history is taken by the doctor. And again, with no cost, no copay, no deductible, it's just not subject to any charge. This is to encourage people coming in on an annual basis just to see what's new, how their health has changed, should medications be modified, should medications be changed. It's just a good opportunity to take stock at that time.
And it's also an educational opportunity, learning about
Yes.
what can we do ourselves, preventative-wise.
Yes, Medicare's started to cover smoking cessation programs,
Wow.
alcohol misuse programs, and a number of other programs that, again, if people are interested in using them, that's fine. There's no requirement that such programs be used, but they can certainly be discussed if the person is interested.
And the fact that they're available,
Yes.
it might make them interested. And you have a local presence, don't we, here in Santa Monica?
Yes, we do. We sure do. At the Ken Edwards Center, Wise and Healthy Aging. We have a state-trained HICAP counselor, Steve Miller, there. Steve serves on Tuesday afternoons. And he has very busy clientele. He's sometimes backed up a couple of weeks. He does Medicare counseling of all types. He talks to people who are new to Medicare, people who have a bill that they don't understand or a statement from a doctor, people who want to find out about money-saving programs, which is another very well-kept secret. A lot of folks don't know as much as they might about